In this video, I want to share something deeply personal and truly extraordinary. It's the story of a 57-year-old man living with end-stage kidney failure, diabetes, and congestive heart failure, someone who was told dialysis was his only option. But instead of starting dialysis, he followed a very specific nutritional approach. And in just 20 days, his GFR didn't just stabilize, it climbed from 4 to 47. Yes, 47. I've never seen anything like this in my entire career. I want to walk you through exactly what happened here. Not theory. Not hype. A documented medical case. This man didn't just avoid dialysis, he regained kidney function that most would consider impossible to restore. On May 14, 2020, his GFR was already dangerously low at 14. Just 1 week later, it crashed to 4. He was rushed to the hospital. At that point, almost every doctor would have started dialysis immediately. But his medical team made a different decision, one that changed everything. And in less than 3 weeks, his GFR rose more than tenfold. To give you a sense of how severe his situation was, after his first dialysis session, the dialysis machine itself needed to be cleaned because there was so much waste in his blood. That's how advanced his kidney failure was. And yet his function recovered. When kidney function returns, life returns. Energy returns. Freedom returns. Going from a GFR of 4 to living normally again. It sounds unbelievable, I know. But this case was published in a respected, peer-reviewed medical journal on November 8, 2024. And I believe it's going to change how we look at kidney care. There's something else you need to know. This man was taking a medication he should have never been given, one that many kidney patients are still prescribed today. I'm going to show you exactly what that medication was, and why it matters, at the end of this video. So stay with me, because this could be the most important part. I need to share one more crucial detail. When this patient arrived at the hospital, he was in severe metabolic acidosis. His kidneys were failing so deeply that his blood had become dangerously acidic. His heart was under tremendous strain. His organs were beginning to collapse under the pressure. In most situations like this, the outlook is grim, very grim. But this man was fortunate. He was cared for by a team of doctors who weren't just skilled, they were courageous. They chose an approach that most physicians would never even consider. And the results are the reason we're here discussing this today. Some parts of his treatment will genuinely stop you in your tracks. Let's be honest, what these doctors did required confidence, experience, and a willingness to think beyond standard protocols. Most medical teams would have rushed straight into dialysis and never looked back. Now, I know what you're probably wondering: what on earth did this man eat to support this kind of recovery? With conditions this severe, stage 5 CKD, metabolic acidosis, congestive heart failure, diabetes, obesity, gout, you might imagine some rare, exotic, experimental diet. But it wasn't anything mystical or hidden. In fact, it was the diet that made all the difference. So let's pause for a moment and consider what it wasn't. It wasn't a strict carnivore diet. It wasn't keto. It wasn't a plate full of ribeyes and oils and ketosis will save me wishful thinking. And it definitely wasn't an all-meat, no-vegetable approach that pretends kidneys can handle unlimited protein when they're already struggling to survive. No. It was something far more grounded and far more powerful. We're going to walk through exactly what he ate next. Alright, let's talk about the part you've been waiting for. What was the diet that helped turn this man's health around? The answer is right there in the title of the published case report: aggressive intravenous hydration and a defined plant-based diet. Yes, a plant-based diet. Not a fad, not a trend, not an extreme experiment. A carefully structured, therapeutic, plant-focused diet designed to reduce metabolic stress and give the kidneys room to recover. There's something important I want you to truly take in. There are no documented cases of stage 5 CKD reversing on a strict keto or carnivore diet. Not in clinical trials, not in case reports, not in medical history. These diets place a heavy metabolic load on the kidneys, especially when they are already struggling. For someone with late-stage CKD, that load can be the difference between recovery and irreversible decline. I know there are many voices online claiming miracle stories of eating nothing but meat and somehow restoring kidney function. But when we look at real clinical evidence, the kind reviewed by medical scientists and published in peer-reviewed journals, we simply do not see those outcomes. Not once. So, if you or someone you love is in stage 4 or stage 5 kidney disease, please understand how critical nutrition becomes at this point. The wrong dietary approach can accelerate damage. The right one can create space for healing. And in this case, it did exactly that. We're going to go step by step through the foods that were used, how they were prepared, and why they made such a remarkable difference. Let's go there together, gently and clearly. Now, let's come back to the practical side of this story, what this man was actually eating. The details are clearly outlined in the case study. His medical team didn't guess or experiment randomly. They followed a structured approach based on research that began years earlier. The diet they used is known as a defined plant-based diet. And it may not be what you might imagine. Let's start with the part that surprises most people: fruit was strongly encouraged. Not limited. Not restricted. Encouraged. This patient had stage 5 CKD and diabetes, and yet his doctors asked him to increase his fruit intake significantly, close to 10 times more than what he was eating before. If he had 1 apple a day before, now he was enjoying a variety of fresh fruits throughout the day. Raw, whole, simple. Some foods received special emphasis, and one of them was avocado. Avocados are unique. Unlike most fruits, they are naturally rich in healthy fats while being gentle on blood sugar levels, which makes them incredibly supportive for patients managing diabetes. They are also packed with antioxidants such as carotenoids, vitamin C, vitamin E, and phenolic compounds, all deeply protective for kidney cells. Another food highlighted in the study was tomatoes. And this pairing with avocado is not accidental. Tomatoes are rich in lycopene, an antioxidant known to protect kidney tissue, support heart health, and help lower blood pressure. But lycopene is absorbed far more effectively when eaten with a healthy fat source like avocado. When you place them together, you create a simple, powerful healing combination. So something as ordinary as sliced tomato with fresh avocado becomes more than a meal, it becomes nourishment with intention and purpose. One thing we should acknowledge: foods like avocado and tomatoes are naturally higher in potassium. So if you choose to include them, just make sure you're monitoring your potassium levels with your healthcare provider. For most people with CKD, especially when the diet is balanced and supervised, fruits and vegetables are not the problem. In fact, removing them is often when kidney function begins to decline more quickly. And no, this man was not living on avocado toast alone. His diet was varied, colorful, and full of life. The core idea was simple: eat whole, raw plant foods as often as possible. Fruits, vegetables, greens, real food that supports kidney health, blood sugar balance, heart function, cholesterol levels, inflammation, and healthy body weight. So, when you're standing in the grocery store, unsure what to choose, let this be your guide. If it grows from the ground and looks like it came from nature, it is far more likely to support healing. If it comes from a factory, a box, or a wrapper, it probably won't. There's more nuance in kidney nutrition, of course, but simplicity helps people follow through. Now, among all plant foods, there are some that offer especially powerful kidney support. In this case, the patient was specifically instructed to eat dark green vegetables, what many of us call leafy greens. Spinach, kale, collard greens, beet greens, cabbage, lettuce, foods rich in minerals and deeply alkalizing to the body. And that last part matters. This patient was on the edge of dialysis because of metabolic acidosis. His body had become too acidic for his kidneys to manage. Dark leafy greens are some of the most alkalizing foods we have. They help neutralize excess acid, protect kidney cells, and reduce the metabolic burden on the kidneys. So, if we were to name the foods that truly helped pull him back from dialysis, spinach and kale would be at the very top of the list. We're not just talking about diet, we're talking about giving the body the chance to regain balance. Next, let's talk about another group of foods that played an important role in this recovery: deep yellow vegetables. These include foods like yellow peppers, summer squash, pumpkin, corn, and carrots. Their deep color comes from beta-carotene and other carotenoids, powerful antioxidants that help reduce inflammation and protect kidney cells from oxidative damage. When we talk about avoiding dialysis, we're really talking about reducing the constant stress and inflammation placed on the kidneys. These antioxidants help calm that process, giving the kidneys space to function and, in some cases, recover. Now, what wasn't included in his diet is just as important. Yes, the familiar things were removed: animal products, sugary beverages, alcohol, highly processed foods, anything that places unnecessary strain on the kidneys or blood vessels. But there was one more step that made this diet different: all added oils were removed. No olive oil drizzles, no cooking oils, no butter substitutes. The fats he consumed came naturally from whole foods, like avocado. This approach helps improve insulin sensitivity, reduce inflammation, and support heart function, all essential in someone living with diabetes and kidney disease. And then, there was one more surprising element: all foods were eaten raw. No steaming, roasting, boiling, or sautéing. Just whole, unprocessed, raw plant foods. This may feel like a big shift, and it is. Eating raw requires intention, planning, and commitment. But in this case, it allowed the patient to take in nutrients in their most natural form, while minimizing metabolic waste and digestive strain. There isn't a large number of studies comparing cooked versus raw diets for kidney recovery, but in this case, the results were documented and remarkable. The raw plant-based diet supported the patient's kidney function when he needed it most. If you're considering trying a raw approach yourself, know that it can support kidney health, but it also works best when introduced gradually, thoughtfully, and with medical monitoring, especially if potassium levels need to be tracked closely. This isn't about perfection. It's about giving your body the gentlest, cleanest nourishment possible so your kidneys have the best chance to breathe and heal. Now, this final part is very important, so stay with me. We need to talk about the medication that was pushing this patient toward dialysis. This isn't about blaming anyone. It's about awareness, because many people with advanced kidney disease are prescribed this medication without realizing the stress it can place on their kidneys. Let's look at the medications he was taking: allopurinol for gout, carvedilol, a beta blocker for blood pressure, vitamin D2, Trulicity for diabetes, Entresto, which combines an ACE inhibitor and an ARB, torsemide, a loop diuretic, atorvastatin for cholesterol. Humalog, fast-acting insulin, Lantus, long-acting insulin, and a prescribed potassium supplement. Among these, one medication was placing a particularly heavy burden on his kidneys. If you guessed Entresto, it's understandable this medication isn't recommended for someone with stage 5 CKD. But in this case, it wasn't the main problem. The medication that was accelerating his kidney decline was torsemide, a high-dose loop diuretic. Loop diuretics like torsemide and also furosemide are sometimes necessary in certain heart conditions. But in late-stage kidney disease, especially when metabolic acidosis is present, they can dehydrate the body, reduce blood circulation to the kidneys, and push them into deeper stress. And that can move someone toward dialysis much faster. Once torsemide was removed and replaced with another approach along with the diet and hydration protocol we discussed, his kidney function began to recover. The reason I'm sharing this is simple. If you or someone you love has advanced CKD and is currently taking high-dose loop diuretics, please talk with your nephrologist. There may be safer alternatives depending on your condition. Your doctor can guide you. Your kidneys deserve every bit of support and protection you can give them. Thank you for being here. Take care of yourself, stay hydrated, and keep choosing foods that support healing. If you want to increase your GFR and protect yourself from kidney problems without having to rely on invasive medical procedures, this 3-step program is for you. And I'm super excited to present you this video because this is not your usual how-to video with tips and tricks that never deliver. This is an all-natural and easy-to-follow guide, full of foods good for kidneys and proven to help with eGFR problems. I've put a lot of research into this, and there's real science behind it. You will be able to see results in just a few weeks. Don't forget to like and subscribe. Question: has your blood test shown kidney damage? If your doctor and your lab tests are giving you more questions than answers, in this video you'll find loads of useful information. Remember, you are not alone, so never lose hope. Kidney disease can be slowed down and in some cases even reversed with some simple changes to your renal diet. I'm here to help you with this in this video. I will try to provide as much support as I can. I will answer any questions in the comment section, so feel free to ask. There's always a way to improve our health, and getting the right information is the first step. I'll get deep into the 3-step program in just a minute, but first, what is GFR? Is it different from eGFR, and why is it so important? GFR is maybe the most meaningful indication of kidney function. GFR stands for glomerular filtration rate, and it's used to define the stage of chronic kidney disease you're in. The glomeruli are the filtering part of the kidney, and the GFR shows how much blood goes through them each minute. eGFR, or estimated glomerular filtration rate, denotes just another way to measure GFR. Both values should be the same or very similar. So, should you be worried about your GFR? Well, it depends. How high is your GFR? What happens if GFR drops below 60? If it is less than 60, your kidneys may have an impairment. Immediately talk to your doctor and schedule the necessary tests to get a diagnosis. Usually, when the GFR drops below 15, your physician will have you start dialysis, and you may want to be inserted on a transplant list. Always get tested regularly and do any other test recommended by your doctor. So here we go, the 3-step program specifically engineered to help kidney patients increase GFR. Step 1. Dietary supplements. I've put some dietary supplements first because they can help people at any stage of kidney disease. Vitamin D is one of the best remedies for the kidneys and should be present in any renal diet. Has your doctor already prescribed it to you? Vitamin D is essential to maintain the right levels of calcium and phosphorus in the blood. It helps build and maintain strong bones, and since it is often low in kidney patients, you have to find a way to get more of it. The best foods to get vitamin D are sardines, salmon, halibut, and other fatty fish. Other foods, like some cereals and milk, are fortified and contain vitamin D too. Getting enough exposure to sunlight is another way to get vitamin D. If you want to take vitamin D supplements, talk to your doctor first. Oligosaccharides. These are carbohydrates found in small amounts in many plants with a distinctive characteristic: they are almost indigestible and can reach the colon unbroken, where they perform the function of a prebiotic. A prebiotic supports your digestive tract health. A recent study found that oligosaccharides and prebiotics are incredibly useful for kidney patients. They have benefits like improved calcium absorption, decreased inflammation, improved immune function, decreased mortality rate, and lowered cholesterol and triglycerides. They're basically a miracle food. How to include them in your diet? Foods rich in oligosaccharides include chicory root, Jerusalem artichokes, onions, leeks, garlic, legumes, wheat, asparagus, and jicama. Step 2. Renal diet to increase GFR. There are foods that support the kidneys and foods that overburden them. The kidney's main job is to purify and detoxify the blood. Foods rich in toxins are what put pressure on your kidneys and should be carefully avoided. I'll talk about them in the last part. What you need to eat to replace them are foods capable of helping the kidneys remove toxins. Once you start eating detoxifying foods instead of foods full of additives and chemicals, you're guaranteed to start seeing results. Apples. Apples are full of pectin, which can bind to heavy metals and cholesterol, helping to remove them from the body. Eat with abandon. Flax seeds. Flax seeds are full of omega-3s, and as I've shown in my previous videos, omega-3s are proven to repair kidney damage. Flaxseed oil is also known for its cleansing properties. Garlic. The active ingredient of garlic, allicin, has antibiotic, antifungal, antiviral, and antimicrobial properties that can help protect your kidneys. It can also help with hypertension. Studies have shown that eating garlic on an empty stomach maximizes its efficacy. Cranberries. The favorite berries of all kidney patients, cranberries prevent bacteria from spreading through the urinary tract, acting like an antibiotic but without the nasty side effects. They are most effective if taken as a supplement. Kale. Not just packed with fibers, kale has antioxidant and anti-cancer properties, thanks to its 45 flavonoids. It is thought to be the healthiest vegetable on earth. Make it a regular on your table. Lemon. Lemon is a powerful detoxifier and can help acidify the urine. It is also rich in vitamin C and can inhibit the formation of kidney stones. Water. Water is the most important thing for your kidneys. If you don't have restrictions on water intake, drink up to 12 cups of water throughout the day to support your kidney health. Step 3. What to avoid to detoxify your kidneys. There are a number of foods, supplements, beverages, and drugs that have been proven to wreak havoc on your kidneys. The kidneys are always the body's first line of defense against toxic ingredients and chemicals, but they also take the biggest blow. Avoid all unnecessary drugs and medications. NSAIDs are among the worst. Several studies have proven their nephrotoxicity. Aspirin, naproxen, and ibuprofen, especially when used to manage chronic pain, have been shown to cause serious kidney problems. Avoid them at all costs. Soft drinks are even worse. Studies have shown a direct correlation between regularly drinking carbonated beverages and kidney disease. Soft drinks can lead to diabetes, hypertension, kidney stones, and, obviously, kidney disease. Whether with sugar, zero, or diet, they're still a threat to your kidneys. Another thing to completely avoid if you want to increase GFR is processed and packaged foods. They should come with a dangerous warning for the kidneys. They are high in everything someone on a renal diet should be careful to avoid: salt, sugar, preservatives, added flavors, and sweeteners. Bad habits like smoking, drinking too much, a sedentary lifestyle, and often being dehydrated are also very dangerous and high on the list of things that can cause kidney damage. Try your best to avoid them. The best part about this 3-step program is that this is the start of a journey toward your health. I know this really seems like a lot and could be overwhelming at first, but a journey toward our health becomes easier as you get closer to your goal. So never lose hope. This is all for today. If you like this video, please like and leave a comment. Thank you for watching.